This is Elizabeth Suresh. I represent Rashmika Centre for Learning and Counselling and also Raksha Educational Trust. In both the places, we take care of children with ADHD. So I just would like to share with you some of my experiences with these children. So I'm going to give throw more light on the interventions which usually happen in taking care of these children. We all know that ADHD is a condition characterized by inattention, hyperactivity and impulsivity, and also that it is a neurodevelopmental disorder. So first and foremost, we need a diagnosis from a medical person. In other words, we need a medical diagnosis. And the treatment of ADHD consists of mainly of therapeutic interventions, and in some cases we do need medication. Because therapeutic interventions alone can help this condition. So let's have a quick glance at all the therapeutic interventions and management of this children in their home, in school, and who all are the people who are going to help them, who all need to work as a team, and that's what I'm going to share with you. As I mentioned, in some cases, the children do need medication. So then you may ask me, what is the role of medicine in this? Some children need medicine as a stimulant, or to enhance cognition, or as an antihypertensive drug. Because without the support of the drug, they may not be able to make themselves available to us. So in some conditions, this decision has to be made by the psychiatrist, the child psychiatrist, and who needs it. That is a decision which they have to make. And in our center, we have some children who do take medicines. And what we have seen is that they are given these medicines for 5 days a week. That is the days when they are available in school. And the weekends, they don't take these medicines. And I do really see how these children are supported by this medicine which has been administered to support them. Because it is necessary for them to make themselves available to their day-to-day activities and academic needs. It helps them to control the hyperactivity and impulsivity and make themselves available to us. When we talk about the therapeutic interventions other than this, the most important role is played by an occupational therapist. The question is, what does an OT do? An occupational therapist engages the child in many meaningful, effective physical activities, and these specific activities are highly therapeutic. These activities help the child to control the hyperactivity, channelize their physical energy effectively, and develop organizational skills. When I say organizational skills, it means starting a task on time, completing a task on time, and the in-between time of maintaining their attention in that, making priorities when they have to do 2 or 3 things, which is more important, which one I'm going to do. So all these are organizational skills. Arranging their bags, arranging their books, arranging the table, or self-dressing skills, all these come under this. And along with that, physical coordination is also very important. Another is impulsivity, and occupational therapy is needed to control the impulsivity. Here, when I talk about impulsivity, I just would like to give you an example for that in the school situation, you hear many children saying that I have written my exam extremely well. But when the results come, when the marks come, it is not at all a positive one. Or they're not happy with it. Parents get frustrated, we get frustrated as teachers. And what happens is that for these children who are very impulsive, their thinking is much, much faster than their writing speed. And when they have to answer 2 or 3 questions, they just read the questions, they know what the answers are, but when they sit to write, they keep moving from one to the other. So when they write the answers, ultimately, you find a mixture of all the 3 questions and their answers into one. So this makes it difficult, but they don't realize that this is happening. So there's an overlapping of answers, overlapping of points. So finally, when the teacher reads the answers, he finds that there is a mixture of everything and it is not at all appropriate. So these are some of the things that we see amongst our children who are very, very impulsive. And they also don't think about the consequences of their action. All these children need occupational therapy. And in our center, the occupational therapist works along with the special educator to support and guide both the child and the teachers. So management is possible only with team effort. The therapeutic use of activities help the child to develop, improve, and maintain skills. Next comes the role of a behavioral therapist. Behavioral therapy is equally important because we come across a lot of inappropriate, embarrassing, frustrating behaviors amongst these children. And behavior modification therapy with lot of positive reinforcement is what is needed. These children need assistance to handle their frustration, manage the anger, and develop skills to cope up with the day-to-day life and the academic needs. Counseling and support group also play a very vital role. Parents and teachers are the ones who always feel helpless. They get exhausted physically and emotionally and frustrated. Here is a mother who was just talking to me the other day. She has a 5-year-old son. She says that she gets so exhausted, so frustrated, so even the sleep she gets is not enough. She says that my son goes to sleep only after 1 o'clock and he gets up very early, and where do I get to sleep? And throughout the day I'm running after him. I don't know how to manage him. Of course, this child needs the support of an occupational therapist to a very great extent. Every day he will have to undergo occupational therapy, and a lot from the behavioral therapist. And the medical person, the child psychiatrist, has to decide about his medication part of it. So counselors and therapists are the people who can give the support mechanism to this, to parents and teachers. Classroom intervention or management is of great importance as children spend a better part of their day in the classroom. So I would like to give few tips to the teachers who are working with these children. What are the qualities a teacher need? First of all, a teacher needs to be consistent. We cannot change our S and no's, or we cannot be very lenient at one time and very strict at the other time. There has to be a consistency. S has to be S and no has to be no. At the same time, when we are consistent, we also are assertive. A teacher needs to be very sensitive to the individual needs of the student as well as the uniqueness of the student. We need to be aware of the frustration tolerance level of the child, the span of attention, how many minutes he can sit and make himself available to us. And we need to be very practical in our approach. I would say that let us live one day at a time and one step at a time, one task at a time. These are some of the rules which we have to follow as teachers. Because we don't know what each day's mood, what each day's needs. If he's disturbed and frustrated about something, even if he plans something for that day, it may or may not happen that day. So that's why I said take one day at a time, one step at a time, one task at a time. But be very consistent and assertive. In the classroom, Seating is very important. So they need a place with minimum distractions, and close monitoring is necessary. When I say distraction, both visual and auditory distractions. It is better to be near the teacher or in the first row, and this will reduce distraction and the tendency to move around. Teacher needs to know the attention span of the child and the frustration tolerance level, so that at what point she should give permission for the child to get up and walk around. Because if the child is going to sit with the same activity for a longer time, that is definitely going to frustrate him. And that is going to be a very inappropriate activity from our action or attitude from our side, and it is going to cause reactions from them. Their responses may not be positive, it will be very negative. So before, the golden rule is that before the child starts squirming on the seat, give him a task. Get up, go around, go to the office room, get the book, come back, distribute the book. See who all are watching the TV, what is the child doing on the computer. So you can give him a lot of activities like that where he can just move away from his seat and do that. And if it is productive, it is going to be much more appreciated. Because if you give him a task like, okay, distribute all the books, see that if all the children have submitted the book, then he feels that he is given importance and he is looked after well, respected well. So these kind of activities can help the child. And we need to be very well planned in situations like this. It is very necessary for a teacher and a student to arrive at a contract. The contract between the teacher and the student is going to be, when am I going to work? When is my break time? What work am I going to do? When can I talk? When I'm not supposed to talk? When I'm supposed to sit and do my activity? When I can take a break? All these things. You also arrive at a decision with the child that what are the rewards the child is going to get. So if all these things are done, you are going to get a 10 minutes extra time to play, 10 minutes extra time to be in the gym or in the playground or on the computer, or you get an extra TV time. So all those things are things which they enjoy. So our rewards can be tangible. It can be stars or biscuits which they can take, or it can be an activity which they like very much, because we have to catch them when they do good. That is another golden rule which we have to keep in mind. So you did it good, so the whole class is going to appreciate him for doing that. Rewards can be given like, as I said, something which is going to be very, very satisfying for them. Similarly, when they don't do things, let us keep away from us the word punishment. They get the consequences of their actions. So the consequences is depriving the child of what they like the best. Again, you may not get playtime today, you may not get your TV time, unless and until you finish your work. So the child need to know what is the consequence of an action when I do not do it. So that's what I said, that we need to be consistent, we need to be assertive, but at the same time we need to be sensitive to the needs of the child. As I am repeating it again, it is not punishment that we are going to give him. We are going to make him understand the consequences of an action. Make him understand this is what happened and why it happened, how it happened, and because it happened, who all are the people who are going to be hurt, who are going to be disturbed, and finally, what is it that you are going to lose? That kind of reasoning and that kind of an approach is absolutely necessary when we meet these children. Concerning teaching and learning, be very practical, be very realistic when we fix the goals. And then when we give concepts also, break it into smaller units, smaller tasks which they can do. which they can take. Because when you are going to give a full assignment or a worksheet to the whole class, see to it that divide it into 5 or 6 parts and give the child so that he will be able to do it effectively and there will be quality in the work which he is doing. So, as I said, continue to be consistent even when we do that. In giving them homework, in demanding work from them, and in giving them rewards and in teaching them the consequences of their action. Consequences are to correct, make them understand that because of this it happened. So, in other words, corrections are happening. The need is lot of positive reinforcement. The more we are positive towards them, the more we are going to look for the good work in them, they are going to be more and more motivated to get that. Because we know that these children always become objects of ridicule and everybody will be there to point their fingers at them. Even if when somebody does something, these children are the ones who get it. So I think we special educators are facing many challenges because we always get interruptions in our work, interruptions in their work, interruptions when we plan a program for them because of the difficulty which the child faces. So we need the help of an occupational therapist, we need the help of a behavioral therapist, we need counseling for these parents because parents and teachers are the ones who need a lot of support from them. So we work as a team for the sake of the child. The family needs to be given necessary tips, they need to be given necessary strategies. We have to teach them how to manage them at home. And similarly, teaching the mother and the father how to be consistent, how to be realistic, and how to be practical, and how to be sensitive towards the needs of the child. So we work as a team. It is only the teamwork which is going to help us in it. So all these interventions, many a times parents ask, why do we need occupational therapy? You are only making them do a lot of jumping and hopping and everything. Yes, that is what is needed, but in a very structured manner. And every activity has a therapeutic effect. A behavior therapist is the one who is going to teach us how to do this positive reinforcement, how to do these corrections, what are the rewards they get when they do something, and what are the consequences when they do not do something. So we work as a team. Only the teamwork and these therapeutic interventions are going to help us in all their efforts. So as a teacher, the challenges are more. As a mother, the challenges are more. So let us get the necessary help from all the people who are involved in it. If medicine is necessary, please do get that. Occupational therapy is a must. Behavior therapy is a must. Counseling and a proper special education program with an individual educational program for the child is an absolute necessity. I think I have just given you a very brief idea of what these interventions are, how these interventions are necessary for these children. Thank you. I'm so grateful for giving me this opportunity. Thank you once again.